So periodontists, you deal with a lot of gum disease, and you treat it a little differently. So let's establish first, what is gum disease or periodontal disease?
Yep, gum disease is just simply a bacterial infection and invasion of the gums that surround the teeth.
Okay.
And resulting in bone loss.
All right.
And the teeth get loose and eventually fall out.
All right.
In its essence. So we treat it nowadays, we start out, generally speaking, with an oral DNA test.
Okay.
Which, think crime scene testing, just like you watch on TV. We have the patient, we collect their saliva, it's tested, and we can find out the specific bacteria that are in their mouth and the numbers of those bad boy bacteria. And then we can target our therapeutics during the course of treatment, during the laser treatment.
So it just kills those bad bugs?
Correct.
In a way.
It's target, well, yes, those bad bugs are the most susceptible to whatever we use.
Okay.
Yeah. And certain things work better on certain species of bacteria, types of bacteria.
Okay.
Then we use, well, for 20 years, there's two ways of treating gum disease. The old way was traditional periodontal surgery, flap surgery, where you cut, open up, scrape, and then suture. And I did that for 20 years. That's classically what I was trained in.
Is that pretty painful?
Can be quite painful afterwards.
Because it's sore, right?
Yep, that's the classic complaint you'll
That's
get
how it's
from
done
patients.
every day in Texas.
Every day in Texas, there's lots of periodontists that do it that way.
Cut open the gums so they can have access to cleaning the root or the lower part of the tooth?
Yes.
Okay.
And then do their thing and then stitch it back up.
But you don't like that way anymore?
No, I don't, because I've been trained in the perilace, or otherwise called LANAP, about 10, 12 years ago. And that's how I do it. I'd probably say 90, 95% of the time now. Most cases can be treated this way. It's less invasive. The wavelength of the laser is targeted to the colored bacteria that cause the problem, the bone-eating bugs, if you will.
Okay.
And it stimulates healing. It's regenerative.
So you just kind of go around the mouth with a laser.
Yes.
And then it kills this infection.
Go around the mouth in the pockets.
Okay.
Right around the teeth. Kills the bugs off. Then we still ultrasonically clean the roots off of all the deposits, the tartar and calculus. And then we go back with a laser again. And then in my office, you take it another step. We use ozone gas. And
what does that do?
It kills everything. It kills bacteria, fungus, viruses, prions.
Without killing the good stuff.
Correct.
The good bacteria in the mouth.
No, it'll kill all the bacteria.
Okay.
It'll basically, but we direct it in the pocket only.
Okay.
Yeah. And then we let the patient heal. And then we see them for post-op visits, and then we encourage them to do their 3-month maintenance visits like clockwork.
Okay.
And that gives us the recipes for success in keeping people's teeth.
So you could either do the invasive surgery route.
That's a choice.
Or you can do this laser route.
Yes.
Which just kills the bacterial infection.
Yes.
I mean, logically, it makes sense.
It does.
I see buttons that say like no cut, no sew.
That's
What does that mean?
That means that we're not cutting and we're not stitching. That means it's just done non-invasively.
And is it true you could even do like before and afters where you could show like slides of swab their mouth and show the bad bugs swimming around?
Yep.
And then after this laser treatment, the bugs are dead.
Yep, they're gone.
Really?
Yeah. Yeah.
And so this is the only way you do it.
It's called
for the most part.
Phase contrast microscope. Yes.
So this is how you do it?
It's
for the
how
most
I do
part?
it personally. Yes. I would say 95% of the time we're able to do it that way.
And downtime compared to the other?
Minimum downtime. Patients often tell me, I hardly had any discomfort, didn't need to take any of the pain medication you gave me.
Is this for like, let's say the crowd that doesn't want antibiotics, the holistic crowd.
Okay.
You could use like some of the ozone, the laser.
Yep, and avoid any antibiotics.
Interesting.
You sure could. Yeah, you sure could.
And then their breath gets better?
Absolutely.
The bleeding gums goes away?
If the bad breath is coming from the gum disease, which 98% of the time it is, then the bad breath goes away.